Okay, so welcome to this month's masterclass. I get a lot of questions about Botox, so I decided to do this month's masterclass all about Botox. There is a whole chapter in my new book about Botox, and but I will go through it now anyway because sometimes it helps people to hear it rather than read it. So I will explain Botox because I've had a lot of questions. So basically, Botox is a medicine that works by injecting it into a muscle, and it causes the muscle to stop working. So people call that facial or muscle paralysis. Basically, it stops the nerve from firing to make the muscle move, because every muscle in your body is innervated by nerves. So nerves go into the muscle, and neurotransmitters are released from the end of the nerve, and they act on receptors on the muscle, and it causes the muscle to fire off and move. So that's how you move, through these nerves firing off and making the muscle move. What Botox does is it blocks that neurotransmitter from acting on the receptor, so the muscle doesn't move. Botox is derived from botulinum toxin, which is a toxin which causes all your muscles to stop moving, and then it can kill you, obviously. But in the amount we use in Botox injections, it is so small and it's so diluted that would never happen ever. So that's nothing to worry about. But some people do want to know why it's called Botox or toxin, and that's where it derives from. So the main way it works, or the only way it works, is by stopping the muscle from moving. Now that's great for your face because the reason you develop lines or wrinkles on your face is because the muscles move. So when you move the muscle of your forehead, which is called your frontalis or frontalis muscle, you create creases in your skin. And same with when you smile, this is a circular muscle around your eye, the orbicularis muscle, you contract it and it causes the skin to wrinkle where the muscle moves. Same with your frown lines or the 11s, when you frown, you create creases in the skin. So creases in the skin are wrinkles. And if you move that muscle over and over again, and that you will create a deeper and deeper wrinkle in the skin by moving the muscle. So one way to not have wrinkles in your skin or in your face is to not move your forehead, or not to frown, or not to smile. But those options aren't usually very realistic for most people. So most of us use our faces to express our emotions, which is normal, and we can't really stop doing that. It's part of it is not voluntary anyway. So you can't really stop your eyes from crinkling or your crow's feet from coming up when you smile. It's not something that you have control over. Unless you don't smile, obviously, or you choose not to frown. So you can choose not to frown, definitely. But some people just make a frowny expression anyway, when they speak. We all move our faces in different ways. It's part of what makes us unique. So facial movement or muscle movement is what brings on wrinkles. So, if you continue to make the same expression or movement with your facial muscles all the time, which most of us do, over many, many years, you will develop wrinkles in the skin, as the skin also changes as we age due to sun exposure and just aging. And the combination of all of that means that you develop these creases in the skin. So to combat that, we can try to make the muscles not move. So one thing is you can, like I said, you can stop moving them yourself, which may be not realistic for most people. And the other option is to do it with Botox or neurotoxin. And neurotoxin basically means the muscle doesn't move. So I have regular neurotoxin injection into my forehead, my frown area, and around my eyes. And I've been doing it for about 11 years. So I've never allowed my skin to become wrinkled to begin with. So when people talk about neurotoxin or Botox being preventative, it is indeed preventative, because if you don't move the muscle and you don't crease the skin, you will not create a wrinkle. So I just happened to start doing it quite a long time ago, partially because of my profession and partially because I have friends who are doctors who wanted to practice on me, because they're learning how to do Botox. And so I was a willing guinea pig, as I usually am for most things. So they tested out on me. So I have been doing Botox for a very long time. So I have not a very strong forehead muscle. This is the extent of the movement of my forehead at the moment. I can't really frown. These muscles aren't really moving. And I do create some crow's feet when I smile. I do have a little bit of laxity here around my eyes. So you can see they crinkle here. There's not much I can do about that, except this muscle doesn't really Oh, there it goes. There it goes. If I really smile, then you can see the muscle move. I should probably put a little more in there. But anyway, around my eyes. But I'm quite happy with the way my my neurotoxin works. I don't inject it very often anymore because my muscles have become much weaker over time because I just don't use them because I've been doing these injections for such a long time. And so I don't really need a lot anymore. And I also don't need it very often. I also don't really frown. And I also don't use my forehead very much. But that's also occurred due to the many years that I have not been able to make those facial expressions. So I've not used my forehead to express myself for such a long time. It's not something that I really think about doing anyway. I do smile a lot, which is potentially why I have these ones around my eyes. But to be honest, they don't really bother me. I think it's natural to have some crow's feet. It gives, or smile lines. It gives some normal expression to your face. So that's how Botox works, or neurotoxin. Botox is a brand name. So Botox is the original brand name for Botox. It's made by a company called Allergan. I use brand name Botox in my patients, but there are other brands. They're all probably equally the same. So there's brands like Dysport, Bocature, and Xeomin, which are actually the same thing, but they all are slightly different in the type of toxin they are, but also in how they're dosed, and if they need to be refrigerated or not refrigerated. So that's the difference. When it comes down to choosing which one to use or to get yourself, go with the one that your doctor knows how to use. So that's more important than anything else. I'm very good at using Allergan Botox. That's the brand that I use. I have no affiliation with that company. It's just what I've always used, and that's what I know how to use. So very good. That's good. When it comes to how much you need, most women need somewhere between 30 and 40 units. Now, unit is the measurement of Botox, and how much is in or how many mils are in a unit and things like that depends on how you dilute the Botox. So Botox comes as an invisible powder in a little vial. You add normal saline to that to dilute it, and it depends on how much dilution you want to do. So I dilute my 100 units with 2.5 mils of normal saline. So I know, so when I measure mine up in a syringe, I know how much volume 1 unit is. So it's like how much in the syringe. And that's how I dose it. So when I think about a woman's face, most women, if you're going to do your forehead, your frown area, and around your eyes, you need somewhere between 30 and 40 units. That's usually a good starting point. As you do more Botox, you probably need a little bit less than that. Some women have larger foreheads, have stronger muscles, or just like to have more because they like to not move at all. So I have patients who go up to 70 units or sometimes more. And I have some patients who only have, I have one patient who only has 2 units here and here because that's all she wants to have, just to reduce the amount of crow's feet she has. So it becomes a very personal choice, and that's why having a consultation with your doctor to discuss what you want to achieve with your neurotoxin is very important. So in an initial consultation, I need to first watch my patient talking so that I know if they have a kind of a problem area or what that may be, and also how much I think they can tolerate in their face. So Botox isn't for everyone. The main kind of rate limiting step for using neurotoxin or Botox in your face is whether or not you have a droopy eyelid. So because Botox stops you from moving your eyebrows up, if you have laxity in your upper eyelid skin and you tend to need to raise your eyelids up, then you will feel like you have a very heavy brow if you can't do that anymore, if that makes sense. So if you cannot move this muscle, but you rely on that movement here to open your eyes, so some people who have saggy lids have that problem, if you have excess skin here, then if you get Botox, you'll feel like you have heaviness in the brow. And that's not the fault of your injector, or that you had too much. It's a result of your anatomy. So if you just have a droopy lid, you will feel heaviness. That is the main contraindication to me for someone having Botox. So if my patient has that problem, we have to sit down and have a chat about that, because it does really change how much Botox they can have, or if they should have it in their forehead at all. So it's not for everyone. There are no risks to having too much Botox injected. It does take up to 2 weeks to kick in. And the main other issue is that you can get a little bruise where it's injected. And it lasts for usually 3 to 4 months. So 3 to 4 months is where you should be aiming for. So that's a whistle-stop tour of what Botox is, how it works, how much you should have or what you should consider if you're planning on having it. And that is our masterclass for the month of July. I hope that was useful for you. Thanks. Bye.